Have you ever glanced in the mirror and done a double take at a sudden bright red splash in your eye? It looks pretty dramatic, right?
It really does.
Today, we're diving into what that actually is. Subconjunctival hemorrhage. We've gathered all the key info, really, to give you the inside scoop on this common occurrence.
Yeah, covering everything from what might trigger it to what's actually happening in the eye.
Exactly. So let's start with the basics. What is a subconjunctival hemorrhage?
Okay, so think of it like a bruise, but a very visible one right on the surface of your eye. Technically, it's blood that's leaked out and pooled beneath the conjunctiva.
The conjunctiva, that's the clear bit over the white part.
Precisely. It's that thin, transparent membrane covering the sclera, which is the white of your eye.
And that vivid red color is just the blood showing through that clear layer.
That's it.
What's always struck me is how alarming it looks, but then you hear it's usually completely painless.
That's a really key point, the lack of pain. What happens is one or more of the tiny, quite fragile blood vessels in the conjunctiva ruptures.
Okay.
And when they break, the blood escapes and gets trapped in that potential space, right under the conjunctiva.
So what makes these tiny vessels decide to pop? What are the usual culprits behind this startling red eye?
Well, often the causes are surprisingly mundane, actually. Minor trauma is a big one.
Like getting poked in the eye? Or something less obvious?
Even less obvious sometimes. Just rubbing your eye maybe a bit too vigorously can do it. Another really common factor is a sudden spike in the pressure inside those blood vessels.
Increased pressure. Okay, that sounds interesting. What sort of everyday things could cause a pressure spike like that?
Think about moments of exertion.
Yeah.
A really forceful cough, for instance.
Ah, right.
Or sneezing really hard, even straining, like lifting something heavy or during constipation. That kind of straining effort is called the Valsalva maneuver.
Valsalva maneuver. Okay.
And yeah, that can definitely generate enough pressure to cause these delicate vessels to leak. But interestingly, in quite a few cases, some studies suggest maybe up to half.
Half. Wow.
Yeah, no specific causes ever actually found. We call those spontaneous or idiopathic cases.
Spontaneous. Okay, so it's not always something you did necessarily. That's somewhat reassuring. Now, are there things that make someone more likely to get one? What are the risk factors we should know about?
Absolutely. We can sort of group them. Trauma, like we said, is a major one.
Yeah.
Any direct injury.
Makes sense.
And perhaps surprisingly, contact lens use comes up quite a bit in studies. One figure mentioned is around 68% of cases, especially in younger people.
68%, that's high. Just the wearing of them or problems with them.
It's often associated with the use, maybe insertion or removal, or perhaps slight irritation from the lens itself. Then you've got those idiopathic cases, no known cause.
Right.
And the Valsalva maneuver, we talked about that coughing, sneezing, straining, that's definitely a risk factor.
So that awful coughing fit you had last winter
Yeah.
potentially could have led to this. What else?
Yeah, certain underlying health conditions play a role too.
Yeah.
Hypertension, high blood pressure is a known risk factor.
Okay.
Also bleeding disorders. If your blood doesn't clot normally, you're naturally more susceptible to bleeds like this.
Right, like hemophilia or similar conditions.
Exactly. And then there are medications, things that thin the blood. Aspirin is a common one. NSAIDs, non-steroidal anti-inflammatories like ibuprofen and anticoagulants like warfarin.
So things lots of people take regularly.
Yes. And other conditions like diabetes, arterial disease, and high cholesterol hyperlipidemia, they've also been linked. Even things like recent eye surgery can sometimes result in one postoperatively.
Gosh, it's a surprisingly broad list of potential contributors, isn't it?
It really is.
So let's picture it happening. What's the actual sort of biological process? What's going on under that clear layer?
It's relatively straightforward, pathologically speaking. As we said, blood leaks out from those fragile conjunctival blood vessels.
Yeah.
Now, because that conjunctiva is transparent, think of it like, I don't know, a very thin layer of clear plastic wrap over the eye white.
Yeah.
That trapped blood is immediately visible as this bright red patch. It's confined there. It doesn't really have anywhere else to go.
And that intense redness is purely the pooled blood being seen.
Exactly that. And the good news, the really reassuring part, is that in the vast, vast majority of cases, this is what we call self-limiting.
Meaning it sorts itself out.
Precisely.
Yeah.
Your body just naturally reabsorbs that blood over time, just like it does with a bruise anywhere else on your skin. Usually no specific treatment is needed.
Okay. Now, seeing any red in your eye can cause a bit of panic. Are there other conditions that show up with a red eye that we should maybe be aware of just to help differentiate?
That's a very important point. While a subconjunctival hemorrhage looks quite distinct, that flat, bright red patch with clear borders,
Right.
it's wise to know other possibilities. A very common one is conjunctivitis, or pink eye.
Ah, yes, the gritty, itchy one.
It's exactly. Often involves discharge, maybe stickiness,
Uh-huh.
a gritty feeling. Then there's scleritis, inflammation of the layer just under the conjunctiva. It's usually more localized redness and can be a bit tender or mildly painful.
Oh, okay.
Uveitis is more serious inflammation inside the eye. That often comes with pain, light sensitivity, maybe blurred vision, along with the redness.
Right, so pain is a bigger feature there.
Often, yes. And then there's acute ankle closure glaucoma. That's an emergency. Sudden severe pain, blurry vision, seeing halos around lights, nausea, and a red eye.
Definitely sounds more serious.
Absolutely. Keratitis, which is inflammation of the cornea, the clear front part of the eye, also causes redness, usually with pain and vision changes. And much rarer, but you could have things like growths on the conjunctiva like Kaposi sarcoma or other neoplasms that might present with redness.
So while the red eye is the common factor, looking for those other symptoms, pain, discharge, vision changes, is really key.
It really is. It helps narrow things down considerably.
Got it. Now, how common actually is this? What do we know about the epidemiology, maybe with a UK focus if possible?
Yeah, it's true that precise record keeping isn't perfect, but we know it's, well, pretty common across all ages.
Okay.
Interestingly, some data suggests it might be seen a bit more often in women, particularly if there's no history of trauma involved.
Curious.
We also tend to see it more in older adults. And maybe surprisingly, it's quite common in newborns, often noticed in the first few days after birth, probably related to the pressures during delivery.
Ah, okay, that makes sense.
In terms of overall figures, one estimate for the incidence, combining traumatic and non-traumatic cases, is around 2.6%.
2.6%, okay.
For the non-traumatic ones specifically, the annual incidence is thought to be roughly 0.6%. So not incredibly frequent for any one person, but common enough that many doctors see it regularly.
And definitely occurs across the lifespan, but maybe a bit more common as we age and in newborns.
That sums it up well.
Right. So let's get down to the experience. What would someone actually notice if they have one? What are the classic clinical features?
Well, the number one sign, obviously, is seeing it. That sudden appearance of a red patch, usually just in one eye.
Unilateral, usually?
Typically, yes. And as we've stressed, most people feel absolutely nothing. It's often completely asymptomatic. Some might report maybe a very mild irritation or perhaps a slight feeling of fullness in that eye, but that's about it.
Okay. And if you looked closely, what's the appearance like?
You'd see a bright red flat area on the sclera under the conjunctiva. Usually the edges are really sharp and well-defined. It almost looks painted on.
Like a splash of paint, yeah.
Exactly. The size can vary a lot, though, from a tiny dot to covering quite a large portion of the white of the eye, depending on how much bleeding occurred.
Does it tend to happen in a particular part of the eye?
In cases linked to trauma, studies show the most common spot is the temporal region, that's the side towards your temple. About 40% of traumatic ones are there. The next most common is the lower part, the inferior conjunctiva.
Okay. And the really crucial thing.
Vision. Vision remains completely normal. That's key. Your visual acuity, how sharp you see, your peripheral vision, your eye movements, all should be unaffected.
And if a doctor looks inside the eye?
A fundus examination, looking at the back of the eye, will be normal too.
So normal vision is a huge reassurance. Any other sort of quirks about how it presents?
Yeah, often the person themselves doesn't even notice it at first.
Really?
Yeah, it might be their partner or a colleague who says, "Whoa, what's happened to your eye?" Also, be aware the color changes over time.
Ah, like a bruise on your arm.
Exactly like that. It starts bright red. Then over days, it might fade and change, maybe becoming a bit greenish or yellowish as the blood components break down before it finally disappears completely.
How long does that usually take?
Typically around 2 weeks, maybe stretching to 3 in some cases, for it to fully resolve.
Okay. Is there ever a time when the appearance of the bleed itself is a warning sign?
Yes, there's one important thing to look out for. If the hemorrhage doesn't seem to have a clear back edge, if it looks like it might be extending further back behind the visible part of the eye, especially if this happens after trauma, and maybe there's also a black eye,
Right.
that could, depending on the history and other signs, suggest something more serious might be going on deeper, perhaps even an orbital roof fracture or an intracranial bleed. Needs careful assessment.
That's a really vital point. So that seemingly simple red eye needs context. Okay, how do doctors usually investigate this? Are tests always needed?
In most straightforward cases, no. The diagnosis is usually clinical based on the look of the eye and the patient's history.
Just looking and talking.
Pretty much. But there are specific situations where investigation is warranted. One key check, especially if there wasn't any obvious trauma, is blood pressure.
Why blood pressure?
Because high blood pressure is a risk factor, and finding it might mean the person needs treatment for hypertension. So if it's elevated, that might trigger a referral or further checks with their GP.
Okay, makes sense. What else?
If the person is taking warfarin, checking their INR level is important.
To see if their blood is too thin.
Exactly. If the INR is significantly above their target range, their warfarin dose might need adjusting to prevent further bleeding issues.
Got it. Anything about the look of the hemorrhage itself?
Yes, like we just touched on, if that posterior border isn't clearly visible, suggesting the blood might be tracking back from somewhere deeper, especially after trauma. That's a red flag.
What would you do then?
That would prompt a more thorough neurological exam, checking cranial nerves, and potentially imaging like a CT scan of the head in orbits.
Okay. And what if it keeps happening?
Recurrent episodes, or if it happens in both eyes at the same time, bilateral cases, that definitely warrants investigation. You'd start thinking about underlying bleeding disorders or other systemic conditions that need to be identified and managed.
So blood tests might be needed then?
In those recurrent or bilateral cases, yes, blood tests looking at clotting function and maybe other systemic markers would be appropriate. But just to stress, for your typical one-off, isolated subconjunctival hemorrhage with no trauma.
No routine blood tests needed.
Generally not, though if there was significant trauma, even if the bleed looks typical, a referral to an ophthalmologist for a full eye check is often a good idea.
Okay, so we've identified it. Mostly reassurance is key, it sounds like. But what's the standard management approach, say, here in the UK?
Reassurance is absolutely number one. Letting the person know what it is, that it looks dramatic but is usually harmless, and that it will go away on its own.
That's probably half the battle.
It often is. General advice. If it followed trauma, consider seeing an ophthalmologist. If it keeps happening, see your GP for underlying checks. And if there's any mild irritation,
What can you do for that?
simple artificial tears can help soothe it. Just the over-the-counter lubricating drops.
Okay. Any specific medical treatments usually needed?
No, not for the hemorrhage itself in most cases.
Yeah.
Artificial tears, maybe 4 times a day if needed for comfort.
Anything to avoid?
It's generally sensible to advise avoiding non-essential aspirin or NSAIDs while it's resolving, just on the off chance they might prolong it slightly, though the evidence for that is limited. But if someone needs them for another medical reason, they should usually continue.
Right. When would you definitely refer someone on?
Referral to an ophthalmologist is recommended for those bilateral cases, or if a bleed is unusually persistent, not clearing up after, say, 3 weeks or so, and trauma cases, as mentioned.
Okay. And there was an important point about infants.
Yes, a really crucial one for anyone working with children. If an infant presents with bilateral subconjunctival hemorrhages both eyes, especially if there are also tiny red spots, petechiae on the face or eyelids,
Yes.
you absolutely have to consider the possibility of non-accidental injury or shaking. It requires very careful assessment and safeguarding procedures.
That's a vital point to remember. Okay, overall then, what's the outlook? The prognosis for someone who gets one of these?
It's excellent. Really, really good. As we've said, it's self-limiting. The blood just gets reabsorbed naturally.
Within that 2 to 3 week time frame usually.
Exactly. And provided it's not linked to some underlying illness that needs managing, the hemorrhage itself is considered completely benign. No long-term effects on the eye or vision.
That's very reassuring. Are there any direct complications from the bleed itself?
Not typically from the subconjunctival hemorrhage itself. It doesn't damage the eye structure. The main complication, if you can call it that, arises if someone has recurrent episodes.
Because that signals something else might be going on.
Precisely. The recurrence is the signal to investigate further for those potential underlying causes, like bleeding disorders or maybe poorly controlled hypertension.
So the bleed itself is harmless, but if it keeps happening, it's a clue.
Got it. Okay, let's try and summarize. What's the main take-home message you want people to have about this sometimes alarming red eye? I think the key thing is, while seeing that bright red patch could definitely be startling, subconjunctival hemorrhage is usually benign. It's typically a self-resolving condition.
Looks much worse than it is most of the time.
Exactly. And, crucially, it generally doesn't affect your vision or cause significant pain.
But as ever in health, it's important to know the exceptions, the times when you should seek advice.
Absolutely. If the red eye happens after a significant injury or trauma, get it checked. If it keeps happening over and over, see your doctor. If it affects both eyes at once, definitely get that looked at. Or, of course, if you have any other concerns that it might be linked to an underlying health problem.
Always best to err on the side of caution in those cases.
Always.
That's really clear, practical advice. Thanks. And just as a final thought, have you ever stopped to consider just how many incredibly tiny, delicate blood vessels are constantly working away silently inside your eyes, day in, day out? It's quite amazing, really.
It truly is a complex and delicate system.
And if you, our listener, are studying for medical exams or just keen to learn more in a clear, high-yield way, do check out passthemsra.com.
And for free resources and questions, there's also freemsra.com, both great sites for revision.